So I'm starting by talking about lessons from the 30s, what health services looked like then before the NHS, and what was the state of people's health at that time. We are back, thanks to austerity, to breathtaking inequalities not so different from those in the 1930s. Children's height is reducing year on year. Chronic ill health, physical and mental, is increasing to levels not unfamiliar 90 years ago. Second, while we still have our NHS free at the point of need, underfunding, private sector plundering, 40 years of being forced to act on business principles to tighten the belt, balance the books, and 70 years of stolen treatments, as if eyes and ears and feet weren't part of one's health, have brought us to the brink of the chaotic, fragmented world of British health services in the 1930s. And third, and to my mind most importantly, people in the 1930s, despairing at what they'd got, developed plans for the future. The clearest and most straightforward prescription for the future ideal health service is that of the Socialist Health Association, which used to be called the Socialist Medical Association, which was first delivered, this prescription, to an appreciative Labour Party conference in 1932. Soon after that came the 1937 report on the British Health Services, which was by an independent think tank, Political and Economic Planning, whose key members had been trained by Maynard Keynes. Both start with a clear message. Their government at the time, didn't seem to have understood that it's really in our national interest to have a well and content population that's really healthy, and that the costs of ill health far outweigh, their idea was 8-to-1 outweigh the costs of a decent all-round health service, and that prevention is in the end much cheaper than simply concentrating on illness. Here's a quote from then. "We need to create boldly and consciously the conditions in which a healthy population can grow and flourish." A second message, which is clear throughout. Profit-making firms should be removed from our health services. These weren't socialists saying this, these were social democrats. Here's a quote from the Social Democrats. "Cunning swindlers deliberately exploit for their own profit the credulity of the public." And they were talking about over-the-counter cures, they were talking about nursing homes, they were talking about private doctors that overprescribe, they were talking about people telling their patients what they want to hear rather than what they needed to hear for their health. Which brings me to message number 3. There was, as Mark has started to say, an extraordinary, fragmented, chaotic patchwork of services in the 1930s. It was more like a set of unassembled, odd-shaped patches, overlapping in some places, entirely absent in others. There was public, there was old poor law, there was voluntary, there was private, there was paid for by donation, contribution, insurance, government grant. Every part of the country totally different, even down to the level of means testing, that is, how much you earned, how little you earned in order to get something free. The reason for this national chaos? I'm afraid it was too much arm's-length regulation which led to poor practice. The kind of regulation that people are saying, we'll do now, all we have to do is to send a few inspectors along or get the contracts right and it'll all work. Well, it didn't then, because Tory authorities turned a blind eye, they didn't inspect regularly enough, they didn't employ enough inspectors. So here we were in 1935, one mother in 260 died in childbirth. Life expectancy had only improved by 5 months since 1871, this is in 1935. So regulation is a very poor substitute for provision. Despite the much trumpeted national insurance scheme, it wasn't enough, and it only helped you if you were in work. So onto the blueprint, onto what they said we need if we're to have a proper health service. The first is it has to be a health service, not just a sickness service. It has to include housing, it has to include water, it has to include drainage, it has to include all of those things that we call the social determinants of health. And your own local doctor needed to work with you to support you and to support the community to provide all those things. They were very clear that without that it wouldn't work. The doctors should work with nurses, health visitors and pathologists in small health centres, small local health centres within a 15-minute walk, dare I say, of where you lived, to make certain that that was the bedrock of your health. That was somebody to walk alongside you, for you to respect, that wouldn't just have 10 minutes to talk to you, would actually go to your home, would look after you. That was the bedrock of the thing, the health centre. You would do research. You would have time as a GP and enough money as a GP and as a nurse to really develop yourself and develop your knowledge of health to the point that you were really useful to your community. The general hospitals would be publicly run. The doctors would not just be salaried, but they would also have free training. All social classes would be able to become doctors, and it would be a really, really respected profession that wasn't just, because in the 1930s it was just for the rich. This would all be under a Minister of Health who would be much stronger than the permissive one that had been set up in 1919. That's the blueprint. The red lines were no private profit, no insurance, no just regulation. The only people to say it should be free, I have to say, were the Socialist Health Association. The SHA were absolutely clear it needed to be free to everyone. And they didn't say just for the poor. In fact, they said if it was just for the poor, it would be a two-tier service and it would be no good. It had to be a health service for the whole nation. What should we get from what I've said for today? Well, the first thing is the NHS is free, but we've got a long way to go on public health issues. I think the 1930s were nearer to preparation for a scarlet fever outbreak everywhere than we will be for the next pandemic. And we need to tackle the social determinants of health. The other is maybe we could learn from 1948, where all the hospitals were co-opted. The staff in private hospitals have been trained by the NHS. Maybe we should just be getting whoever is pulling their manifesto together to say they would simply compulsorily purchase all the private hospitals, take them over. Striving for real health, not just the absence of sickness, and recognizing that the costs of ill health far outweigh the costs of providing services to promote good health, should be core to any social democratic, not just socialist, manifesto. Finally, keeping the profit motive out of our future health services, services which are currently riddled with the contract culture, the burden of PFI, staff who've known nothing else but the purchaser-provider split. Let us take heart from the fact that in the 1930s, capitalists could see that profit should play no part in any part of our health services. Maybe we can teach all parties that lesson.